Hey everybody, welcome to the answer session of this week's Ask Dr. Dan. Again, this week we were talking about Epat or Shockwave Therapy, which is a non-invasive treatment for multiple musculoskeletal conditions. So let's get to the questions. So the first question is, what conditions does Epat treat? So it could treat a number of soft tissue conditions such as tendinitis, like tennis elbow or Achilles. It can also treat muscle strains, trigger points in the back and neck. So it could treat a whole lot of different conditions. Now, depending on what's going on, there might be recommendations for other treatments that I think work better, but Epat actually has a lot of indications for different uses. The second question is, how long is each treatment? So again, the treatments are anywhere from about 3 to 6 weekly. Each treatment takes about 10 minutes. Again, remember from the previous video, there are 3 parts. The first part is right on the area of pain. The second part is that surrounding tissue, and then the third part is that massage. So all 3 of those parts combined take about 10 minutes. Number 3 is a good question. Does it hurt afterwards? The answer is usually not. Actually, the percussive treatment actually usually numbs the area. So the area actually usually feels pretty good for a little while after the treatment. Now again, this builds up as you go on. So a day or so later, that pain may come back after the first few treatments. But right after, actually, most people feel pretty good. Next question is, how long until you feel results? So that's very variable from person to person. There are some people that as you're doing it, you feel a difference. I've had some people that even after the first treatment feel much better. What we usually tell people is that full results can take anywhere from about 8 to 10 weeks after the last treatment. So some people it's a gradual buildup. Some people even during the course of treatment feel completely better. So everyone's a little bit different with that, but we tell people that it can take some time. And the last question is, can you use this with other treatments? Yes. So sometimes this can be combined with some regenerative therapies like PRP or stem cells. What we will typically do is do the Epat first and just kind of stimulate that tissue. And then afterwards, you can put the regenerative treatments in, usually about a week or 2 after the last Epat treatment. That being said, for a lot of people, though, Epat is effective for those conditions, so it may not be needed. I usually recommend doing as little as works. So if the Epat alone works, then perfect. If we need to give it that little boost, then we'll do that. So those are all the questions for this week's Ask Dr. Dan. Remember to follow us on all our social media, Facebook at Apex Center for Regenerative Medicine, Instagram at RegenerateNJ, and subscribe to our YouTube page for all of our videos at Apex Center for Regenerative Medicine. I hope you all have a great weekend, and remember, don't operate, regenerate.